Let's talk about herpes.
Fine. And then my first retort to you is, why? Because I have not seen a case of herpes in any of the red people in the last 40 years. There is no such thing as red skin syndrome with herpes. They do not have eczema herpeticum because they don't have eczema anymore. They have eczema kids had scratched areas and excoriations, and the herpes virus jumped from a cold sore or from mother's cold sore to the scratched area and grew and grew and grew and went internally to the liver, to the brain, elsewhere, and was fatal often. Very sick. Kids were sick. Well, the red skin syndrome don't have excoriated areas like this. They don't have that kind of problem. They have a vascular problem deeper down. So the herpes has nothing to do with the skin in this situation. It has no fertile field to sit and grow like it does in the excoriated crook of the arm or behind the knee. I have had fights with at least 50, especially British doctors. They all believe that these little water blisters from steroids that have no pattern of herpes simplex are herpes, and they admit them to the hospital, scare the hell out of everybody. They keep them there for a day or two because they're cured within a day or two. They pump them full of IV acyclovir for herpes, and they say, what a wonderful doctor I am, I just cured herpes. Well, you got eczema herpeticum, you're sick or you're dead, and over the course of 3 to 4 weeks. Period. Not seen a case because it doesn't happen anymore. It's so overdiagnosed and believed by these people, these doctors. It happens in America too. Usually the institutions, where they gather around on round 7 of them and they all argue, and each one is trying to show how much smarter they are than the other guy and says, oh, that's herpes. And I look at the picture and say, it's blisters from steroids. They're not sick. They're not ill at all. Herpes, eczema herpeticum, they got high temperatures. They're in serious problems.
These therapeutics, these drug therapies for herpes to prevent flares. Extrapolating what you're saying, is that an unnecessary treatment in your mind's eye?
Well, they're panicking because they've never seen a case, because the severe cases were 40, 50 years ago, but they read about it. And they're fearful of it going internally, so they right away rush them to the hospital and. Well, the patients are better within a day or two. They sign themselves out and they walk away. Or they kick them out because the rash is gone. Well, eczema herpeticum doesn't work that way. Never did. Go look at the old textbooks.
But there's people watching this video right now that are taking therapies for herpes.
Recurrent herpes. Multiple episodes. Impossible. Impossible. Doesn't work that way. There's nobody who has that kind of herpes repeatedly and is in jeopardy. Misdiagnosed because they're poorly trained doctors observing and not making the right observation, not doing corroboratory lab tests, not a blood test, a swab and trying to grow it out in culture. That takes 2-3 days, and scaring the hell out of the patient and the family. It's another one of the misdiagnoses. And I'm not in every patient's back pocket to try to correct it, or a fly in the wall. I can't fly around the whole world. My wings are not strong enough. But I'm saddened that how bad the medicine is, how bad the therapy is from this very simple diagnosis. The length of time to cure befuddles most doctors, and they're jumping around because of the demands of the patient, the fear of the patient, the anxiety of the patient, or their own anxieties. And they're trying everything new, and the drug companies have moved in with 5 or 6 brand new drugs approved at exorbitant fees, $40,000 to $80,000 a year.
So someone that's taking an oral today to keep from having a herpetic flare-up, what would be your message to them?
Well, they're not taking preventative acyclovir. That would be rare, but
But there are preventative therapies for herpes.
It's taking the acyclovir, but they're not reporting to me that. But if the doctors are scared enough about recurrent herpes eczema, then they're going to tell some to stay on oral drug for the rest of their life or for years. I do not know of a specific patient, but it probably is going on out there.
But you're saying herpetic eczema.
Eczema herpeticum is the classic disease in the old textbooks.
Shortened to just herpes. You've got herpes.
You have herpes on top of your eczema. Well, these red people are not eczema people. They're red skin syndrome, and their diagnosis is steroid addiction. It is not bad eczema.
How do people get that diagnosis of steroid addiction? Where do they go to have someone look them in the eye and say, yep, you're steroid addicted?
Well, if you're a logical, sane human being, patient, not doctor, you see that, I went to the drugstore, I had jock itch. I play basketball in the summer, or my baby has slobber dermatitis. I went to the drugstore, got 1% hydrocortisone over the counter, put it on, groin, hand, wherever, face. Got a little bit better, but I put more on, and after 2 weeks it still was there and was spreading a little bit. Well, I'm worried. I went to the doctor, the dermatologist, and they prescribed something stronger. That means upping the ante. That's called approaching addiction. I put it on. It worked for a while, but then it came right back again. I was really panicked. I went back to that doctor. In fact, tell you the truth, I went to another doctor, another dermatologist. I didn't trust the first one. I'm making this story up, but I've heard it a million times. He gave me a stronger steroid. He gave me a super potent steroid that really closed the blood vessels down. It suppressed everything quickly. Within 10 days, the rash was back and worse, spread all over the body. Well, any sane human being would say, something's wrong here. It's called addiction. Every time I did something, it got worse. Each time it got, the opioid, the alcoholic, the amphetamine user gets worse and worse as he takes more and more of the drug. Same diagnosis. It's called addiction.
Let's leave it there.